There is one vitamin sitting in your kitchen right now that can literally dissolve dangerous blood clots forming in your legs. And most people over 50 have absolutely no idea which one it is. While you're watching this video, thousands of seniors are suffering from a silent condition that's slowly destroying their circulation, causing excruciating pain, dangerous swelling, and putting them at risk for heart attacks and strokes. The most terrifying part is that this condition sends clear warning signs that most people completely ignore until it's too late. Your legs are trying to tell you something urgent right now. That strange tingling sensation you feel when you sit too long, those cold feet that never seem to warm up no matter how many blankets you use, or that nagging pain that shoots up your calf when you walk to the mailbox. These aren't just signs of getting older. These are emergency signals from your circulatory system, screaming that something is seriously wrong. Poor blood circulation affects over 60% of adults over age 60, yet most doctors barely spend 5 minutes discussing it during routine checkups. They'll check your blood pressure, maybe listen to your heart, and send you home with a clean bill of health, while dangerous clots are silently forming in your leg veins. The consequences of ignoring these warning signs can be catastrophic. We're talking about deep vein thrombosis, pulmonary embolisms, heart attacks, and strokes that could have been prevented with the right knowledge. But here's what medical professionals don't want you to know. The solution isn't found in expensive prescriptions or risky surgical procedures. The answer is already in your refrigerator, sitting on your kitchen counter, or growing in your backyard garden. For specific vitamins have been scientifically proven to dramatically improve circulation, dissolve existing clots, and protect your cardiovascular system from future damage. Before we dive deep into these life-saving nutrients, I need you to do something important for your health journey. Hit that subscribe button right now and ring the notification bell. This information could save your life or the life of someone you love, and I want to make sure you never miss these crucial health revelations. Also, if this video helps you understand something important about your circulation, show your support by hitting that like button. Your engagement helps me reach more people who desperately need this information. Now, let's talk about the 5 alarming signs that your circulation is in serious trouble. The first warning sign is numbness and tingling in your legs and feet. This isn't the temporary pins and needles feeling you get from sitting in an awkward position. This is persistent numbness that happens even when you're lying down, walking around, or trying to sleep. Your nerves are literally starving for oxygen because your blood isn't flowing properly. The second sign is chronically cold feet and hands. If your extremities feel ice cold even in warm weather, even when you're wearing thick socks and gloves, your circulation is failing. Your heart is struggling to pump blood to your furthest body parts, leaving them deprived of the warmth and nutrients they need to function properly. The third warning sign is leg cramps and pain during physical activity. Medical professionals call this claudication, and it's your muscles screaming for oxygen. When you walk upstairs, take a short stroll around the block, or even stand for extended periods, your leg muscles start cramping because they're not receiving adequate blood flow. This pain forces you to stop and rest, limiting your mobility and independence. The fourth sign is dramatic changes in your skin color and texture. Look at your legs right now. Are they unusually pale, blue, or red? Is your skin becoming thin, shiny, or developing dark patches? These color changes indicate that your tissue isn't receiving proper oxygenation and nutrition through your bloodstream. The fifth and most visible warning sign is the development of varicose veins and spider veins. These aren't just cosmetic concerns, they're visible proof that your circulatory system is under severe stress. The valves in your veins are failing, causing blood to pool and create those unsightly, painful bulges that many people try to hide under long pants. If you're experiencing even one of these symptoms, your circulation is already compromised and you need to take immediate action. The scary truth about poor circulation is that it doesn't just affect your legs. When your blood can't flow efficiently through your lower extremities, it creates a domino effect throughout your entire cardiovascular system. Your heart has to work harder to pump blood through narrowed, clogged arteries. This increased workload raises your blood pressure, strains your cardiac muscle, and dramatically increases your risk of heart attack and stroke. Poor circulation also affects your body's ability to heal wounds and fight infections. That small cut on your leg that should heal in a few days ends up taking weeks or months to close. Minor injuries become major medical problems because your immune system can't deliver infection-fighting white blood cells to the affected area quickly enough. But the most dangerous consequence of poor circulation is the formation of blood clots. When blood moves too slowly through your veins, it starts to thicken and stick together, forming potentially deadly clots. These clots can break loose and travel to your lungs, causing a pulmonary embolism that can kill you within minutes. They can also travel to your brain, causing a stroke that leaves you permanently disabled. Here's where most people make a critical mistake. They assume that circulation problems are an inevitable part of aging, something they just have to accept and live with. They resign themselves to pain, limited mobility, and increased medical expenses. But this couldn't be further from the truth. Your circulatory system has an incredible ability to heal and regenerate when given the right nutritional support. The 4 vitamins I'm about to reveal don't just mask symptoms like prescription medications. They actually repair damage at the cellular level, strengthen blood vessel walls, improve blood flow, and dissolve existing clots naturally. The first circulation-saving vitamin is niacin, also known as vitamin B3. Medical researchers call this the architect of your blood vessels, because it literally rebuilds and strengthens arterial walls from the inside out. Niacin works by dilating your blood vessels, allowing blood to flow more freely through narrowed arteries. It also has the remarkable ability to break down cholesterol deposits that have built up on arterial walls over decades. But here's what makes niacin truly special for circulation. It activates something called the vasodilation response, which causes your blood vessels to relax and expand. This increased diameter allows your heart to pump blood more efficiently, with less effort, reducing strain on your cardiovascular system while dramatically improving circulation to your extremities. Niacin also plays a crucial role in cellular energy production. Every cell in your body needs energy to function properly, and niacin is essential for converting the food you eat into usable cellular fuel. When your cells have adequate energy, they can perform their repair and maintenance functions more effectively, including the cells that line your blood vessels. The best natural sources of niacin include tuna, salmon, chicken breast, turkey, beef liver, mushrooms, green peas, and sunflower seeds. Just 3 ounces of tuna provides over half of your daily niacin requirements. However, there's an important warning about niacin supplementation that most people don't know. Taking high doses of niacin supplements can cause something called the niacin flush, which involves intense redness, burning, and itching of your skin. While this reaction isn't dangerous, it can be extremely uncomfortable and frightening if you're not expecting it. More importantly, taking excessive amounts of niacin can stress your liver and interfere with blood sugar regulation. This is why getting your niacin from whole food sources is always the safest and most effective approach. The second circulation miracle is vitamin C, which I call the cement of your circulatory system. Most people think of vitamin C as something you take to prevent colds, but its role in cardiovascular health is far more important. Vitamin C is absolutely essential for the production of collagen, the protein that gives structure and strength to your blood vessel walls. Without adequate vitamin C, your arterial walls become weak and prone to damage. This weakness allows cholesterol and other substances to penetrate the arterial lining, creating the plaque buildup that leads to atherosclerosis and blocked arteries. Vitamin C acts like cement, keeping your blood vessel walls strong and improve two harmful substances. But vitamin C does something even more remarkable for your circulation. It's one of the most powerful antioxidants in your body, protecting your blood vessels from free radical damage that occurs naturally during the aging process. Free radicals are unstable molecules that attack healthy cells, causing inflammation and accelerating the breakdown of your circulatory system. And here's something that will shock you about what happens when your vitamin C levels drop below optimal ranges. When your vitamin C levels fall below optimal ranges, your blood vessels literally start falling apart at the molecular level. The collagen matrix that holds your arterial walls together begins to deteriorate, creating microscopic tears and weak spots where dangerous clots can form. This is why sailors on long ocean voyages used to develop scurvy, a condition that caused their blood vessels to rupture and bleed uncontrollably. Vitamin C also plays a critical role in iron absorption, which is essential for healthy red blood cell production. Without adequate iron, your body can't produce enough healthy red blood cells to carry oxygen efficiently through your circulatory system. This creates a cascade effect where poor circulation leads to iron deficiency, which leads to even worse circulation. The most potent natural sources of vitamin C include red bell peppers, oranges, strawberries, kiwi fruit, broccoli, Brussels sprouts, and cantaloupe. Surprisingly, red bell peppers contain nearly 3 times more vitamin C than oranges. Just one medium red bell pepper provides over 100% of your daily vitamin C requirements. However, there's a crucial warning about vitamin C that could save you from dangerous side effects. Taking megadoses of vitamin C supplements can cause severe digestive problems, including diarrhea, nausea, and stomach cramps. More seriously, excessive vitamin C can increase your risk of developing kidney stones and can interfere with certain medical tests, giving false results that could lead to misdiagnosis. The third circulation powerhouse is vitamin E, which I call the clot dissolver. This fat-soluble vitamin has the remarkable ability to prevent blood from clotting inappropriately, while still allowing normal clotting to occur when you have an injury. Vitamin E works by inhibiting platelet aggregation, the process where blood cells stick together to form clots. But vitamin E goes far beyond clot prevention. It's one of the most powerful antioxidants for protecting your cardiovascular system from oxidative stress. When your blood vessels are constantly exposed to free radicals from pollution, processed foods, and normal metabolic processes, they become inflamed and damaged. Vitamin E neutralizes these harmful free radicals before they can damage your arterial walls. Vitamin E also improves the flexibility and elasticity of your blood vessels. As we age, our arteries naturally become stiffer and less flexible, making it harder for blood to flow smoothly. Vitamin E helps maintain the smooth muscle cells in your arterial walls, keeping them flexible and responsive to changes in blood pressure and flow. Research has shown that people with adequate vitamin E levels have significantly lower rates of heart disease, stroke, and peripheral artery disease. One landmark study followed over 80,000 participants for 14 years and found that those with the highest vitamin E intake had a 34% lower risk of developing heart disease. The best natural sources of vitamin E include almonds, sunflower seeds, hazelnuts, spinach, broccoli, kiwi fruit, and wheat germ oil. Just 1 ounce of almonds provides over 7 milligrams of vitamin E, which is nearly half of your daily requirement. Sunflower seeds are particularly rich in vitamin E, with just 1 ounce providing over 70% of your daily needs. But here's the critical warning about vitamin E that your doctor probably hasn't told you. Taking high doses of vitamin E supplements can actually increase your risk of bleeding, especially if you're taking blood-thinning medications like warfarin or aspirin. Vitamin E can enhance the effects of these medications, potentially causing dangerous bleeding episodes. Additionally, some studies have suggested that taking large amounts of synthetic vitamin E supplements may actually increase the risk of certain health problems, including prostate cancer in men. This is why getting your vitamin E from natural food sources is always the safer choice. The fourth and perhaps most misunderstood circulation vitamin is vitamin K, which I call the circulation guardian. Most people think vitamin K is only important for blood clotting, but that's only part of the story. Vitamin K actually plays a dual role in your circulatory system, promoting healthy clotting when you need it while preventing dangerous clots from forming inappropriately. Vitamin K activates proteins that regulate where calcium goes in your body. Without adequate vitamin K, calcium can accumulate in your arterial walls, creating hard, inflexible plaques that block blood flow. This process, called arterial calcification, is one of the primary causes of atherosclerosis and heart disease. But vitamin K does something even more remarkable. It activates a protein called matrix GLA protein, which acts like a calcium traffic director, ensuring that calcium goes to your bones and teeth where it belongs, not to your arteries where it causes problems. This protein is so important for cardiovascular health that researchers now consider vitamin K deficiency a major risk factor for heart disease. There are 2 main forms of vitamin K that your body needs. Vitamin K1, found primarily in leafy green vegetables, is essential for proper blood clotting and wound healing. Vitamin K2, found in fermented foods and animal products, is crucial for directing calcium to the right places in your body and preventing arterial calcification. The best natural sources of vitamin K1 include kale, spinach, collard greens, Swiss chard, and Brussels sprouts. Just 1 cup of raw kale provides over 600% of your daily vitamin K requirement. For vitamin K2, the best sources include fermented foods like sauerkraut, kimchi, and cheese, as well as egg yolks from pasture-raised chickens. But here's the most important warning about vitamin K that could literally save your life. If you're taking anticoagulant medications like warfarin, Coumadin, or other blood thinners, you need to be extremely careful about your vitamin K intake. These medications work by blocking vitamin K's role in blood clotting, and sudden changes in your vitamin K consumption can make these medications either ineffective or dangerously potent. This doesn't mean you should avoid vitamin-rich foods if you're on blood thinners. Instead, you need to maintain consistent vitamin K intake and work closely with your healthcare provider to monitor your medication levels. Many people make the mistake of completely avoiding green vegetables when they start taking blood thinners, which actually makes their circulation problems worse. Now, let me address a common misconception that confuses many people about vitamin K and blood clotting. Some people worry that eating vitamin-rich foods will increase their risk of developing dangerous blood clots. This is completely false. Vitamin K helps your body maintain proper clotting function, which means it prevents both excessive bleeding and inappropriate clot formation. The difference between healthy clotting and dangerous clotting comes down to location and timing. When you cut yourself, you want your blood to clot quickly at the site of injury to stop bleeding. This is healthy, appropriate clotting that vitamin K supports. Dangerous clotting occurs when blood forms clots inside your blood vessels without any injury, potentially blocking circulation or breaking loose to cause strokes or heart attacks. Vitamin K actually helps prevent dangerous clots by keeping your blood vessels healthy and flexible. When your arteries are strong and smooth, blood flows freely without the turbulence that can trigger inappropriate clot formation. When your arteries are damaged, rough, or inflamed, blood flow becomes turbulent, creating conditions where dangerous clots are more likely to form. Here's what you need to understand about getting these circulation-saving vitamins from your diet versus taking supplements. Whole foods provide these vitamins in the exact ratios and combinations that your body needs for optimal absorption and utilization. They also provide additional nutrients, fiber, and beneficial compounds that work synergistically to support your cardiovascular health. Supplements, on the other hand, provide isolated vitamins in potentially inappropriate doses. That can cause imbalances or side effects. Your body has evolved over millions of years to obtain nutrients from food, not from concentrated pills. When you take a high-dose supplement, you're essentially conducting an experiment on your body with potentially unpredictable results. Power to transform your circulation and protect your cardiovascular health is literally sitting in your kitchen right now. Every meal is an opportunity to flood your body with the nutrients it needs to repair damage, strengthen blood vessels, and optimize blood flow. You don't need expensive medical procedures or prescription medications with dangerous side effects, but timing is crucial. The longer you wait to address your circulation problems, the more damage accumulates in your cardiovascular system. Every day that your blood vessels remain inflamed and damaged, every day that your circulation remains compromised, is another day closer to a potentially life-threatening cardiovascular event. Your body has an incredible ability to heal and regenerate when given the right nutritional support. People who have suffered from circulation problems for years often see dramatic improvements in just weeks. When they start eating the right foods, the tingling in their feet disappears, their leg cramps stop, their energy levels soar, and their overall quality of life improves dramatically. Remember, you have the power to take control of your circulatory health starting today. Your heart, your brain, and every cell in your body will thank you for every healthy choice you make. The path to better circulation isn't found in a pharmacy or a surgeon's office. It's found in the produce section of your grocery store, in the choices you make at every meal, and in your commitment to treating your body with the respect and care it deserves. But is optimal circulation really just about these 4 vitamins? What other hidden factors might be silently sabotaging your cardiovascular health without you even realizing it? The answers might surprise you and could revolutionize how you think about protecting your heart and blood vessels. If this video opened your eyes to something important about your circulation health, consider leaving a super thanks to show your appreciation. This financial help allows me to continue bringing you these incredible health revelations and helps the channel reach even more people who desperately need this life-saving information. Your support makes it possible for me to dive deeper into the research and share discoveries that could transform lives.